Hello. Hi. I'm here with Barely Bear. It's April 8th, 2025, April 8th. Um, I was here with Barely Bear. He just fell over. Maybe he can sit there. I'm just back from the doctors. I think our last health illness update was the 17th of December, 2024. And so that makes this April 8th, 2025, update 27. If I haven't lost count, I think it's 27. So, as usual, I'll look through the calendar and see everything that happened since then, which was a lot. So, 12/17. So, that looks like I had just had a follow-up on the 2nd of December with Dr. Lim, so that would have been covered in the 12/17 episode, and I would have been telling you that I have specialists coming up and scans coming up. Those are, of course, now in the past. So 12/24, I went into New Haven for a PET scan. That would be the first PET scan of this whole story. And, certainly didn't want to have to go all the way to New Haven. Certainly didn't want to have more nuclear medicine and MRI stuff. But my understanding of the PET scan is they may cancel it at any time, as with most of these things, because somebody else needs it more than you, whether it's the surgeon or the machinery, or the machinery's down or something, which is fine. But I think in the PET scan, a lot of times, if they're not happy with your blood work, much like with chemotherapy, you have to go there ready. But among your readiness is to be told that not today. But at any rate, they did my blood work and everything was, functioning. And they saw me, I think, on time. And I had a drink. I forgot the volume now, but I'm going to guess it was a quart and a half or something. Of a drink that takes in the I don't think dye is the right word, although I suppose it's a electroradiographic dye, but the nuclear medicine. And they said, "Oh, it tastes like lemonade," and I thought, okay, and it looked like lemonade. Okay, I mean, probably lemonade stand powder mix lemonade, nothing fancy, but just lemonade. And I drank it, and it tasted like lemonade, like good. I was really happy that it wasn't chalky and foul tasting, and then you have a limited window of time, and you're supposed to drink this whole thing in order for the test. So it wasn't a big issue. The people were really kind. I was also told I'd have to sit in a room and not move and not think for, I don't know, 45 minutes, something like that, prior to the test. That turned out not to be the case, at least for me this time. They were like, "Oh, you can sit there and read or look at your phone." And I think I just sat and listened to a podcast. Maybe I don't recall. But it was fine. Anyway, I did the test, which I think is essentially an MRI machine, for all intents and purposes. And then a couple days later, the 27th of December, I went to meet the hand surgeon, which I think was my first meeting with them. I think that's right. Who was great. I really, really appreciated. I've talked about that in other forum besides this, and I really appreciated the question he asked me. He came in and he said, if you could be anywhere at any time, where would you prefer to be? And I said, right here, like right now, here. And he said, well, I'm about to jab you with a needle, or whatever he said, something like that. And he's like, we just met. Like, where would you really want to be? And I gave him my philosophical answer, like here and now is kind of the whole point. Um, and it's not because I really like you or because I really don't, or because I want to get it over with, or because I think it's great being here, or because I don't. It's just that this is all that there really is. And I want to be where all of it is. And your company's plenty pleasant. And then we had a really, really interesting, he really engaged with that on a philosophical level. And so we chatted quite a bit. So it felt really fruitful. And I appreciated him and his question. I feel like I got some good treatment understanding, treatment education, treatment plan for this trigger finger, which that's pretty good for closing. You could see it. It's not quite closed as far as I would like. I think, I can get it there, but how far it kind of wants to go is a little bit less closed than the other fingers. But anyway, I was very glad I got to meet Dr. Scanlon, and I was happy to introduce him to other people. On the 31st, I got to return to see Dr. Mevbore, my pulmonologist, who examined me, and we checked in on things. He didn't see anything new to concern himself with. He was able at that point to see the results of the PET scan, I think, before I actually talked to my oncologist about it. So that was good. I think that's the case. He was seeing the results. But if he wasn't, then we talked about what am I going to be wanting to pay attention to in the results. So in either case, it's just I don't remember now. I was very glad to have him on the team to think about, hey, we're about to get new imaging on my lungs. What do you see? How would you like to weigh in? What would you like me to pay attention to? Or what questions can I ask when I see the next experts? So that was all really good. On January 3rd, I went to the physical therapist, occupational therapist, and I got fitted for a splint, like a limitation. What was it called? I forgot the particular term of the type of splint, but it's a specialized splint that restricted the movement to just one of the joints of this hand. And I think I was supposed to wear that for 3 or 4 weeks, pretty much 24 hours a day, unless I'm washing dishes or showering. So I got fitted for that. I was really, I was very happy with the gentleman I met and the staff there. That was in Guilford, next to the health food store, NatureWorks, right off Goose Lane. And and I wore that as you would expect, religiously, like definitely better than anybody else. I would take it off like 3 times a day for a few minutes to exercise, whether that was massage, stretch, or strengthen. But the stretching and strengthening, I did not allow to activate the actual joint in question down here. But I wanted to make sure that the rest of the finger, was not offline. And I had pre-approved that with the physical therapist. And by the way, right before I went to the physical therapist, I was featured as a guest on Resilience Radio, which is a podcast by Irving Eisenberg in Vermont, who is an occupational therapist, physical therapist. I use both terms because I'm not sure if one of them is actually accurate to him, but one of those terms is what he is. And so I was able to share that podcast with the different staff at both of those, the surgeon's office and in the OT office. So that was January 3rd. January 6th, I went back to Dr. Lim, my oncologist, for a follow-up, who had seen my ctDNA, my CEA, my CAT scan, and the PET scan. Everything looked happy, and she set me up for an appointment for April 8th, which was today, which I'm returning from, hence the next one of these. But she seemed content and didn't tell me to change anything about what I was doing. January 13th, I got to see the urologist, which was my first appointment with him. And he turned out to be a martial artist. We were very interested to talk martial arts and philosophy of martial arts, which was his great interest. I didn't get any intervention or medicine or anything, but I got to share my story and hear from him about what he thought. And he remains on my team if I need it, but I don't think I'll have to see him again. I think I peed in the office and stuff. So I think I did see him once more after that as a follow-up, but so I think this is the initial consultation visit. Yeah, that's right. So he scheduled me for an ultrasound, which I went to on January 18th. That was a tough one because, I drank, there's rules, but, don't eat at this time, for this many hours and only drink clear fluids or whatever it was. And I did definitely followed it all. And I got there and she's like, your bladder looks empty. Drink some water and I'll be back. And I was just drinking, and she came back in. She's like, it doesn't, you raised this much. I said, well, I don't feel dehydrated, but I'll be patient. I'll keep drinking. I'm sorry if I mess up your schedule. They didn't make me feel like I was messing up their schedule, so maybe this happens. But I felt like I had done what I was supposed to do. It just was taking however long it took to fill. So I just sat in the room, barely bare an eye. You remember that one? And I just got in, kept drinking water. I prefer my water really ice cold, and she was happy, or generous enough, hospitalizationful enough to keep bringing me cold water, which I appreciated. I drank and drank and drank, and eventually she said, I'm sorry, you gotta really, really have to pee, but that's when we started the procedure, and I was fine. And she did it. She didn't notice anything, which she told me, but of course I have to wait until I see the urologist again. So January 27th, I got a blood draw for ctDNA, the results of which I just got this morning, if I'm not mistaken. Then I returned on February 3rd to the urologist, who was obviously saw the results of the sonogram. He was just looking for anything that might have been missed, and I think it was kind of a conservative due diligence to check on that, which he told me at the time, and I was fine. And the results of that were not any cause for alarm. I think he said the prostate was a little bit swollen, but right in line with my age and not causing me any complaints. And so I think he basically released me from his care unless something changes, and then I'm to call him right away. So that was all a positive experience. On the 18th of February is when I returned for this time I returned to Madison. I had gone to Brantford initially for the hand doctor, but I saw him in his Madison office the second time. I don't see this on my notes, but I'm pretty sure that's the second visit. So that means that's when he said you're done with the splint, which I've kept so I can use it here and there if I'm doing very physical things and feel like it gives me a little bit more security. But I'm essentially off it, and he told me keep strengthening it. Call him if anything ever goes wrong, because it's the kind of thing that can recur. That trigger finger that I had, and he felt and I felt that we caught it early, intervened early, We went the 2 route of injection plus splint, and it basically feels resolved now. It definitely still feels like a little bit weaker and not quite as flexible, but like zero complaint or pain. Uh, but I didn't want to just reflexively go and get a shot, um, and I didn't want to reflexively go get surgery. And he said, another shot could be on the table, surgery could be on the table, the splint could be on the table. But he said sometimes this just resolves like for good, and that is more likely if we catch it early, which we seem to have. So I can't really control that outcome as with any outcome, but it does feel like I was glad I met him. I'm glad I was able to do the therapy. I'm glad that it seems to have been resolved. But we'll see. Maybe it returns, and I have a feeling I'll recognize its return early on if it does. Um, uh, so that's February 18th. So again, I'm just looking through the calendar. All of my medical appointments are in banana yellow, so I'm just basically scanning for anything that's yellow. So the 21st of March. Oh, so yeah, so we're almost up to date. I saw Dr. Rubenstein, that's my GP, and we were checking my blood work, and I don't remember. I got some blood work on order for him, which I completed this morning. I don't think we had any sort of new complaints or anything. Obviously, he was looking at the CT scan and such, but I don't think anything really came up from that. Oh, yeah, okay. Now I remember because I'm looking at the rest of this. Yeah, okay, so I'll return to that. So I mentioned to him because I felt like none of the big things were, liver, colon, lungs, uh, were jumping out and needing further intervention. So I said, look, I'd like to, uh, enter into the record a complaint that I've had for a couple of years that has been debilitating for me. As you would guess, I don't use that word lightly, but it's affected me every single day, pretty much every single hour. And I would say probably a 6 to an 8 on the pain scale, or at least discomfort scale. And so I've had this issue in my lower back, which is new. It is not the same as my L5S1 spondylolisthesis and sort of long-term problem. And it doesn't feel neurologic. It feels muscular, but it could be like a joint issue, like an SI or a QL muscle issue. But I said, I'd love to have you weigh in and send me where you send me, or have me try something that I haven't thought of, or I'd just like to have you weigh in. So he gave me a pretty, I thought, fairly thorough assessment, especially since I sprung it on him. I wasn't there for that. Um, and and he said, let's send you to PT and have them assess what it is, treat you for it, and they'll track the results, and we'll see if you improve through their protocols. So I said, that's great. If you have somebody you recommend, great. And he did. He said downstairs, it's not even in the Yale system, but some great folks. Okay. So we made that appointment. So that was 21st. So on the 26th, I went in and I had an eval. Correct, yeah. And that eval I want to see if I can get his name right now. I want to say Joseph Rosenblatt, but I feel like it's not Joseph. Is it Josh? That might be more right. I think it might be Josh. Ah, it wasn't either. It's Adam. Yeah, I just haven't registered it in my brain, and I'll tell you why. So Adam Rosenblatt, who's PT, DPT, um, and so I went in to see him, and it felt like a very thorough assessment and objective measurements noted. And he said it seems more likely in the SI joint area. And of course, there was no trauma, and it had been a long time. And I explained why I hadn't complained about it because I thought, and I still think, that there were higher priorities, and it was more of an inconvenience than something that caused me to not be able to perform my duties or not be able to sleep or something. But boy, really, really uncomfortable. That's in fact why I'm sitting in this position. And it's quite uncomfortable to stay in this position, actually. If I wasn't on the camera, I'd have shifted myself. But anyway, I was really glad to meet him, and I had his full attention in a closed door office. Um, and the office itself seemed quite friendly, quite clean, quite busy, and quite. You kind of felt like everybody understood why they were there, including the clients. And it was quite packed with clients. Uh, it didn't feel like anybody was going through emotions. I mean, of course, they were going through emotions, but not in a mental way. And that's like clients and staff, whether professional staff or non professional staff, meaning I think more sort of gym cleaning staff or professionally licensed staff, just in my estimation. So it was a pretty good feeling. I went to a tournament after that, so I wasn't home. The day after I got back to the tournament, I had my CT scan on the 31st. So I guess I had just said that my GP would have seen the CT scan, but I guess I hadn't had it yet. So they would have seen my ctDNA. So I had the CT scan on the 31st of March, which is just a few days ago. And so that's Monday morning, the day after my return from New Hampshire. So anyway, then I was knocked down sick, just not like I think the first time in a couple decades. Just the best way I can explain it is I I did my morning classes and I think I did my evening classes, and all of a sudden I just felt like I was a bowling pin looking up towards the front of the lane and seeing a bowling ball come my way and saying, A, there's no way I stand up to this. B, there's no way I minimize it. There's no way I avoid it. I'm just a bowling pin. I'm about to get knocked and go flying and knocked down off my feet and end up in the gutter, as it were, which I did. And so my first session with Adam, the PT, would have been on Wednesday the 2nd, and I called up and I said, I think I'm pretty sick, and which means I'm probably contagious and don't think I should be there. If you guys think I should be there, I will get there and I will do it. And if you don't think I should be there, I will be in my bed and I will do the exercises. Because when I first saw him, he said, I think I know which exercises I'll have you do. And I asked for a printout. He said, well, I'll teach them to you when you get there. And I said, look, I probably know whatever exercises they are. But if you don't want me to, that's fine, no problem. But if you're up for it and you give me the printout or send me the PDF or whatever, I will start doing them and I will do them every day. And he said, great. And then he said, well, these two do every other day, but everything else do every day. And I said, how many times a day and so forth. So, so anyway, I already knew the exercises he would have me do, or at least the core ones. But then I felt badly. I finally, after 2 years, was getting this thing starting to be addressed. And I had my first appointment. I missed it because I was sick. Thursday morning, the third, Sarah called my GP, and I said, look, I think this is when I come in to see the doctor. And they said that we don't have an opportunity for that. Go to urgent care. And then they helped out and said, here's which urgent cares are most likely to see you soonest. And it was like North Haven and I don't remember, Colchester, I don't know, Niantic, and I don't know, Southport, or so, I don't remember. So I said, well, let's just say yes. We'll just go to Niantic, wherever that is. Uh, I thought, oh my goodness, I couldn't even imagine getting in the car, like getting to the car, much less all the way to Niantic, much less back. But we did it, and Sarah drove, of course. And so somebody saw me Thursday morning, um, uh, um, hmm, who was osteopath. Um, so the DO that saw me, um, and the nurse, everybody was great. It was really much bigger office than I thought it was going to be. Um, they were very conscious about sort of contact and droplets, and got me tested, did a good intake. And they told me the test is going to test for four things, which I think flu, pneumonia, COVID, and RSV, I think. Um, and they said, if it's this, it means we go here. If it's this, it means we chest x-ray you and go here. In either case, we'll know in 40 minutes. We'll call you when we know. We'll tell you what we found out, and then we'll prescribe this or ask to see you again or send you for an x-ray or whatever. I said, okay, fine. This may work out that on our way home, we get the news that we need an x-ray, and we'll just stop for an x-ray on the way and just keep it going. And it turned out it was flu A, which I guess is the worst one. I don't know. Um, and that means you get Tamiflu, and um, quarantine yourself a little bit, which I had been doing anyway, apart from going to the doctor. So I started the Tamiflu. A couple hours later, somebody managed to go get it for me. A couple of people offered. And then that whole weekend, and I was completely out of it, like crazy headache and stuffy and coughing and all that kind of stuff. A whole bunch of people came through and offered to bring medicine and bring soup, and a bunch of people did bring soup, and that helped Sarah eat, helped me eat. So I'll keep saying yes to that. So thank you. Okay, and then the 7th, which was yesterday. Oh, there's my exercises. I got my exercises there from the doctor. It's kind of funny. So I'm gonna just. I feel badly that I couldn't remember his first name, but in fairness, I just met him twice now. But I had this like crazy headache and completely out of it here with the flu for a while. So please accept my apologies to whomever. So anyway, I got to go yesterday, still recovering from the flu, to my first actual session. So I did that, and it was great. I was really grateful. Everybody was just as they seemed they were when I first peeked in, and I did all my exercises, and I hurried back, and then I taught a class. I was a little bit late for my advanced class because of the therapy, but my advanced class was really generous enough to get started and not give me a hard time, and so once again, I'm very grateful for them. And that brings us to today, which is the 8th. So I return to physical therapy tomorrow. So I'll go twice a week. Um, I think what they do is, at the end of a month, which I don't think is a calendar month, it's roughly a month of visits. Then they reevaluate and they remeasure you and see, I guess, is it working, or is it working fast enough, or is it, do we need to see you, or more or less, or not at all, or whatever. I think that's, um, and I suppose if it's not working, then they're targeting the wrong thing and they adjust. That's kind of my expectation, but I'm happy to have somebody give me exercises, so that's fine. By the way, a lot of them are for the sort of adductors and hips and pelvis kind of thing, so I'm just kind of doing them while I hold and brace and getting that practice in. Okay, so today I saw Dr. Lim. Got my port flushed, which I'm really, really glad to do. If we're able to make it work, it's very, very good news. I just came back from her. Um, so she said my CEA was good, my ctDNA was negative. My blood work, sort of quote blood work, meaning the overall gestalt of it, was good. Okay, but here's the the less objectively happy, optimistic news. She said, "Look, on 11/27, your CAT scan had a 1 centimeter measure of, I don't know what term she used, nodule. Yeah, it was 1 centimeter." I said, "Okay," and she said, "Your latest CT scan, which is March 2025, so whatever date that was." Um, Probably not the most efficient use of our video time here. Oh, didn't I do it like right before or right after the Concord trip? Yeah, it was the 31st. Yeah, so I'll just write it down here so I have it. March 31st. That wasn't a good use of your time, sorry. So 1 centimeter in 11/27. So basically the start of December. So all of December, all of January, all of February, and all of March. So across basically 4 months, maybe 4 months and 2 days or something, but 4 full months, she said it measures 1.5 centimeters. So, of course, any growth of anything, especially here and here, any growth is a concern to the oncologist, who's, I guess, her the chief reason for her employment in my healthcare team is to watch for growth, right? And the idea being early intervention is more effective and less costly and less painful, and it carries a greater outcome opportunity and percentage than later in noticing these things later. So from 1 centimeter to 1.5 is the growth. So she said, that's concerning. Okay. She did say the CA is negative, the ctDNA is negative. The PET scan that saw that 1 centimeter, I think she said nodule, and I don't know, it might not make a difference, lesion, nodule, growth, node, whatever, tumor, I don't know. They might be essentially all interchangeable at certain phases, but I think she said nodule. She said the PET scan didn't flag that at all, right? And the PET scan is kind of like when the bank robbery detective lines up everybody in town and then puts a UV light on them, and one person is covered in purple dye, like, we know who the perpetrator is. I mean, it's you. You're standing right there, Sheila, like covered in dye. And the PET scan apparently does that with cancerous stuff. But I don't know that much about the PET scan. Maybe I can miss something. I suppose that's fine. She did say she was a little bit confused. She said, our recent and all of the other methodologies of assessing this didn't show cause for concern, but it clearly grew, and that's objectively a cause for concern. But we can't be sure if that is, in fact, your bowel or something else, right? Meaning, she said it could just be a part of your bowel that's taking that shape. In which case, she didn't say this, but I think the intimation was like, well, then it's just nothing. Like, the oncologist shouldn't be looking at that as just your weird colon doing a weird. Okay, but of course, they don't want to presume the best of things. They want to presume the worst of things, which is great. That's fine. So she said, it seems like it's a tricky place to biopsy. So I asked her why, because of related structures. Is that why? And she said, no, because it looks like it could be the bowel, in which case, if we perforate the bowel to try and biopsy what we see, we could be just creating an infection problem by perforating the bowel. So I don't like that idea. And I said, okay, that makes sense to me. So she said, I reached out to Dr. Billingsley, who I'll remind you who that was. And she said, I wanted to ask him to review the whole thing, see what he thinks or what he sees. And I want to ask him about putting in an arthroscopic port by which I guess we could get a um, 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 a biopsy. I was thinking tissue sample, and that's not quite what I wanted to say. We could get a biopsy. I didn't realize they would do a port for a biopsy, but okay. I had talked to him previously about doing arthroscopic work, and so assuming he'd be the one that would do it, I'd be super up for that. Okay, so Dr. Billingsley is my liver doctor. Dr. Pantel was my colon doctor. At the time, my oncologist was Dr. Stein. The three of them were in the team, Stein having put the team together. That role is now Dr. Lim, who I saw today. So Dr. Billingsley was the liver doctor. The original cancer was the sigmoid colon near the end, where it makes this little shape. And it metastasized to the top of the liver. And so at one point, both of those doctors went in. And so they cut me, right up and down like a zipper, right up and down the middle. There was 42 staples there. And they, Dr. Billingsley, I'm trying to remember who finished. Yeah, Dr. Billingsley went in, took out the part in the liver, then the section of the colon was removed, and then I was stitched up. Yeah, I could have the order backwards because I don't remember now. I think Dr. Billingsley stitched me up. Anyway, they both went in, did their thing. They both had clean margins on the tumors that they resected, so that's great news. And nobody's seen any positive indication of stuff there. The only cancer that they found, or they think they found, after the surgery was uh, lung met in a few locations, which we went the radiation route for that rather than chemo or surgery. Everything since then has been kind of surveilling the whole system to see where else it pops up, if it pops up, or how it pops up. This is the first time anything else has come up. Maybe, again, maybe it's nothing, we just don't know. So she reached out to Dr. Billingsley to have him weigh in. One of her thoughts was that they might do an arthroscopic port, whatever that means. I don't know if that's like a semi-permanent port, or I don't really know. No, there's my ports here for the chemotherapy, and they accessed that today. So I asked, so is this 1.5 centimeter thing on the hepatic dome? And she said, no, it's over by your hernia. And I said, well, I have a hernia everywhere. I have the one where they remove the colon on the left lower belly quadrant, the anterior quadrant here. But then I have like herniations right up and down the front. And so I think what she was saying was she meant near where the colostomy bag was, where I was left open, just as I reached down with my left hand to the left of my belly button and a little bit lower, kind of that area, which is herniated. So she didn't hear back from Billingsley yet, and obviously I'm sure we'll follow up and we'll hear. So she said, I want to schedule you for another PET scan. She said, when we hear from Billingsley, he might decide to cancel the PET scan, which it's easy to cancel it. It's hard to make it. So I have scheduled that now. And she said, and he might want the results, but also want to do other stuff. Either way, we'll get you on the PET scan system, and maybe you'll stay on it. Maybe something will change. So I assume I'll hear back from Billingsley or Lim and figure out what the next steps are. So the scan we scheduled it for Saturday. That's Dr. Lim. That's April. Could that be right? Let's see. I'll finish this whole talk in a moment. So we scheduled it for 5/10. So I guess in a month on a Saturday. Wouldn't mind a ride either there or back or both. Probably don't need it, but it would be fun to go with somebody. And maybe I could take the train there and meet somebody and, get something fun to eat in New Haven after. So the question that I have is that Dr. Billingsley's the liver doctor. And he worked over here in my body. And over here, I think, it is where, near the sigmoid, is where the current issue is. So I'm wondering why she reached out to Billingsley rather than Pantel, who is the colon doctor. And I think she's describing what she thinks this is a colon adjacent issue or a colon issue. So I'm wondering, when I was at the office, I was still just trying to make sense of it all, so I didn't really challenge this point. But now I'm having time to think about it. It's been a couple hours and I made some notes. And I'm wondering strongly enough to think, I wonder if she reached out to the wrong doctor. Like she sees that this could be a return to a colon issue, and she reached out to one of the doctors involved when I had the colon surgery, but in fact the liver surgeon, whereas she meant to, or it would have been better for her to reach out to the GI surgeon, the colon uh, doctor, Dr. Pantel. So I'm going to check on my chart, which is like the user interface, and ask, um, just in case, we're not getting the best advice from the right person. Um, Either way, even Billingsley might, if it's not supposed to be him, he might say, "Isn't this a Pantel thing?" And they'll sort it out. But I might do my part and say, "Just reach out. Have we reached who we need to reach?" And maybe I'm misunderstanding where it is. I don't know. Um, so anyway, that's the update. I'll go back to PT tomorrow. I'll keep that PET scan appointment if they want to keep it. I have my next appointment with Dr. Lim right after that PET scan, a week later or something, I forget. So I guess there'll be more updates. This is where I would hold up the QR code for my GoFundMe, which I really, really need help with, but I didn't look it up, and so I don't know. But a lot of you guys continue to help without having GoFundMe take 30%. So it's really helpful when you help directly. Um, right now, I'm just pretty worn out from the flu and I'm trying to recover. So um, if you're interested and you want to be part of the next NADON workshop for long life, reach out. Maybe we can include you. Thank you for being here, Barely Bear. And thank you, Dr. Bear, too. Thank you, everybody, for sticking around for this crazy journey. Love.